Clinical Anatomy is a unique course that is enhanced by the generous contributions of our donors. It has been designed to provide a fundamental overview of clinical anatomy and to prepare you for your clerkships and medical career. While the course is challenging, we have created this video for you to offer some study and exam preparation tips. We hope you find this video informative. However, while the study strategies discussed in this video may help some of you, keep in mind that everyone learns differently, and the most important thing you can do is to find a strategy that will help you succeed in this course. We would like to assure you that there are various resources available to ensure your success here in clinical anatomy.
Hopefully you will find these tips useful, and they will help you not feel like a bonehead when anatomy begins. I hope you found that humorous. Anatomy is a block where making a schedule for yourself can help tremendously. When planning your schedule, take into consideration that there are only 4 exams and that all the PowerPoints and lecture notes for each exam are posted at once. That being said, it is very important to study prior to coming to class, whether that is the evening before or the morning of that class period. For example, I usually studied for about an hour by myself prior to coming to class. I would pull up the lecture notes and PowerPoint slide by slide and read through them the night before and also again usually the morning of class. I also loved the tutor-led group review sessions the mornings of class. We typically met for 2 hours before lab to go over the material for that day. I found that previewing helped me follow along better in class and allowed me to use the time in class to work through potential exam questions with my table group and try to make the 2nd, 3rd, and 4th degree connections that are essential for success in this block. I'm not saying that this is the best way to study for anatomy. This is just a method of studying I found to work best for myself. Others studied for as little as 30 minutes or for more than 2 hours prior to class. Some found it helpful to have Netter right next to them and identify the structures as they went through the notes concurrently, or go through the notes and PowerPoints alone. It really is dependent upon what makes you feel prepared to take away what you learn in class that day. However, the common thread that appeared to be pivotal in being successful in anatomy was to prepare prior to coming to class. Lastly, it can be helpful to identify which topics or sections are unclear and make a list of questions to ask your lab instructor to help clarify.
Each class period is 3 hours long. The first hour and a half is an interactive lecture with frequent stops to review the structures on the donor. The PowerPoint slides will be displayed on the screen at your labs during lecture. Make it a priority to identify each of the required structures during your brief pauses in lecture. Compare the structures on the donor with models or pictures in Netter's Atlas. If there is extra time, go back and review the other structures that you reviewed earlier in lecture or from prior class sections. You are not required to take notes during the lecture portion. The PowerPoint and detailed lecture notes are available for you to view online or print at your convenience. I would suggest that you use the time in lab to ask questions of the instructors or clinicians and identify appropriate structures on the donors. During the second half of lecture, you will either be dissecting your half of the donor, asking thought questions of the table instructor, or reviewing the lecture material by examining the dissected half of the donor in Netter's Atlas. Learn to identify the structure based on the various landmarks you see around it. Ask yourself, why is it what I think it is? Pretend you have X-ray vision. What structures are in front of it, behind it, and surrounding it? Don't be afraid to ask your table mates to identify something. Take turns pointing out a structure or asking what might happen if that structure was injured, what deficits or symptoms would result. By taking advantage of every opportunity that you have to study these donors over the next 15 weeks, not only do you honor their legacy and gift, you will gain priceless understanding of human anatomy. In addition, you are also gifted with the presence of incredible local clinicians that have taken their time out of their day to teach medical students. So ask questions, be interactive, and thank them for their time. Best of luck.
It's important to remember that you're a unique learner, and the best way to succeed in this course is to be aware of your learning styles and play to your strengths. For those of you who are more visual learners, it will be important for you to print out the slides and then use your own colors to highlight the information that's important. It's also a great idea for visual learners to have a large whiteboard and actually draw the structures or pathways for yourself. Auditory learners do best when hearing the information, so read the PowerPoints and ask your thought questions out loud. Even teach it to yourself in a mirror. Teaching the material to someone else is also a great way to ensure you have a solid grasp of the material. Kinesthetic learners need to spend quality time in the lab. The NAU and U of A students will be sharing your donor, and they have class on Mondays and Wednesdays, which means you can spend time looking at the dissections they've already done to help you prepare for labs on Tuesday and Thursday.
Outside of lab, it is very important that you review the lecture material on a regular basis. For me, it was helpful to go over the lecture notes and PowerPoint slides both before and after class. This way, I was able to see the material multiple times, and it helped ensure that I did not fall behind, which is something that you should try and avoid. Whether you're studying by yourself or with friends, I recommend you go over the PowerPoint and lecture notes concurrently. By doing this, you're able to visualize the structures and read about their functions. We also suggest that you get together in small groups to help quiz each other and go over any difficult concepts. Furthermore, it will be highly beneficial for you to spend time in the anatomy lab outside of class. While the diagrams and pictures provided in lectures are helpful, it is a very different experience when you practice learning on the donors. This is especially important because all of your exams will be utilizing the anatomy labs and donors, which is why understanding the anatomical relationships in 3D will help you succeed. Lastly, we have come up with several suggestions you can do while in the lab to help you do well in this course. First, form small groups of 3 to 5 people with group members from different tables. As a group, study the donors at each person's table and have that individual point out key structures and instruct the group. Every donor is different, and it is important to be able to recognize the various differences in human structures. In addition, open lab sessions held prior to exams are a great opportunity to ask questions, review material, and practice applying your knowledge. Reviewing several donors in the gross lab not only allows you the opportunity to prepare for the variability seen in each donor for the exam, but also allows you to take advantage of an invaluable resource. Anatomy is truly learned through repetition, so make sure the material is something you are reviewing continuously throughout the exam block to best prepare for your exams.
So a few things to remember. Pay attention to the clinical correlates, as this material presents a basis for exam questions. All exam questions will map onto one or more of the learning objectives, so use the learning objectives to test your readiness for the exam. Repetition is the key. You can also make up your own 2- or 3-step USMLE style questions and quiz each other. For example, identify a structure and describe how a patient might present if that structure is injured, or predict which nerve or muscle might be injured based on the symptoms of the patients. Tutors will also send out practice questions before every exam. There are a number of great resources out there, including Visual Body and Muscle Pro. However, these should only be used to reinforce content taught in the actual course. You're only responsible for information presented in the PowerPoints and on the lecture notes. Finally, we want you to not only succeed in this course, but to excel. The faculty and tutors are available throughout each week to work either one-on-one or with small groups.
During this block, you have 4 exams that will all take place in the clinical anatomy lab. Each student starts at a different question that is designated by numbered labels around the lab. You have 40 plus multiple choice questions on each exam with 90 seconds to complete each question. A significant number of questions will require identification of structures on donors, models, and images in order for you to answer the questions correctly, while others will be freestanding questions.
And more importantly, the questions are designed to have a multi-step thought process to test your knowledge well beyond just identifying structures. For example, you might need to identify a structure, know what nerve innervates it, how it receives its blood supply, or what deficit a patient will experience when it's non-functional.
All questions are written from the lecture notes and PowerPoint from class. No other outside information will be asked. You will be asked to identify any normal variants in anatomy, as not everyone's internal structures are exactly the same. You will not be asked to identify pathology on a donor, but it's important to know what they are to answer pertinent freestanding questions. As you begin to read each question, it is very important that you read it word for word. If you skip over even one key word, you may end up getting the question wrong. If you don't understand the question, read through the answer choices to see if it can guide you toward the right direction. Make sure to read each question twice to rule them out before deciding on the best answer. If you find yourself running out of time, remember you only have 90 seconds. Try to write down as many notes on your exam packet as you can so you can refer back to them if you have extra time on another question. You may end up doing this a lot, as some questions may require 30 seconds, while some may require the full 90 seconds, all depending on your readiness. You won't get to go back to any question station, so if there is a structure to identify on a donor, try to write down what you think it might be or what major landmarks are around the tagged structure.
On the other hand, you also have the option to preview upcoming questions so that you can fully understand what is being asked so that you may quickly answer them when you have reached the respective station. I personally found this very effective during the exams, and knowing a little about the question before going to that station helped me to anticipate the structures that could be tagged. However, the strategy of how you utilize your time is up to your discretion.
In this video, we've given you tips and advice as to how to succeed in clinical anatomy, but keep in mind that at the end of the day, the amount of time that you put in studying is going to determine how well you do in this course.
Do you want me to get out of the shot while she's talking?
No.
You're just like awkwardly like.
Sorry, can we fix this a little bit?
Lastly, we have come up with. Oh my lord, just choking.
Touch it? You want me to touch it?
Can you do anything with this? Like look at them, I don't know.
Like, do you want me to like chew gum and walk at the same time?
I do. Pat your belly and rub your head.
Okay, yeah. Now I lost my spot.
Stay there. Okay. Ready?
Okay.
Next spot.
Images and netter. Okay.
Yeah.
Come on, you gotta say where there's a will, there's a way.
I don't, oh God.
Oh yeah, I was gonna pop it. Yeah, you got
Yeah.
I can't get behind you guys.
You can just.
Can you roll in?
I'll be like,
Oh, I'm falling.
Oh no. I've improvised on the script quite a bit.
I'm reading the script. Okay, never mind.
When he's done talking.
Yeah.
One more. Get my boot up.
Oh.
Serious. Right, we gotta